I'm Tarah Ballinger, and I'm a breast oncologist with IU Health Physicians. I've been in practice since 2017. I think I've always wanted to be a doctor ever since I was a little girl. I think the specific desire to be an oncologist happened while I was in medical school here at the IU School of Medicine. I was able to watch some of the people who were my teachers and my role models, who are now some of my colleagues, really form these deep connections with the patients that they were taking care of. I think that bond with people is really what drew me to medicine in the first place, and specifically to oncology. I think we have this great privilege of being able to celebrate with patients during the best times, but also we're with them through some of the most vulnerable or most difficult periods in people's lives, and that's a really great responsibility and a special privilege that I think is really a gift, and that's really ultimately why I became an oncologist. So when patients first come to see me for a first consultation, I try to come in and really get an idea of what the patient is trying to get out of the visit. Everybody has a different goal or a different reason for coming to see me, so I try to make sure that we set those goals from the very beginning of our visit. We'll spend a lot of time with me getting to know you, trying to find out what your medical history is, but also who you are and what you enjoy and what kind of things are important to you. And then we'll talk a little bit about specifically why you're there and make a list of all the questions that you have so we can make sure we cover all those through the visit. If we need to do a breast exam, then I will have you get undressed briefly for that, but I like to do all of the discussions while you're fully clothed. And then we'll go through all the details of what's going on, the diagnosis, the treatment plan, and make sure all your questions are answered. I really try to empower patients with a lot of knowledge, but I try to make that very digestible and easily understandable. We'll ask a million times what questions you have, and we'll also give you our contact information, so the inevitable question that you forget to bring up while you're in your visit, you'll be able to easily contact us and make sure we get everything squared away. What I love most about my job is honestly the days that I have clinic and get to see my patients. I have a lot of special relationships and friendships with them, and I usually can't wait to see how they're doing. I do have a research position here with the hospital, so I also love that I'm able to let my experiences with patients motivate me to ask research questions to hopefully improve the life of our patients and hopefully prevent the disease of cancer altogether. So I think working here in an academic medical center and being able to see patients, there's a great interplay between my patient care responsibilities and also being able to do research that's motivated by my patient experiences. So when I am not working and in my spare time, I really like to try to make a focused effort to spend that time with my good friends and with my family. I also have a sweet little dog, Roger, who's very cute and makes it impossible for me to do work when I'm at home. I also have a personal interest in exercise and fitness, so I try to make sure I do something along those lines every day. I really like training for races, running and cycling, and I think that kind of dedication and goal setting is something that's really carried over into helping me do my job better, and it's also a great stress reliever.